I want to share with you some verbal skills on what to say when, and these are about financial discussions for the dentist and the entire team. So a couple things that I want to add on to what Linda said earlier is, yes, absolutely having the system in place and having weekly follow-up and daily follow-up, as well as having a designated person or two designated people, depending on the size of your practice, depending on the specialty of your practice. You know, if you're a pedo practice and you're seeing lots of children and lots of volume, or ortho, you may very well have more than one financial coordinator, or you may split some of those duties to be able to handle all of the patients that you see. So one of the things that I want to add is that when you use the dental software and use the payment table in the dental software and keep that updated and accurate, that allows for ease of calculation the next time the patient needs treatment. Because so many times team members struggle with, you know, how do I estimate the patient's portion? And so I want to share some verbal skills with you around that, as well as some tips of how to keep that payment table updated and accurate, so then you have a much closer estimate of the patient's portion for their next treatment or for their next appointment. The second thing that I want to add to what Linda said earlier is to keep all of the PPO plans or HMO plans that you participate with listed separately with separate adjustments. So, for example, if you participate with Delta Dental and MetLife, you would have a MetLife adjustment and you would have a Delta Dental adjustment. And the reason why that you do that is because that will give you an accurate total of what you're actually producing from those patients with those plans and what you're actually writing off. And it's so important to know those pieces of information, and that way you can make educated decisions on staffing and schedules and supplies and budgeting and patient care and all of those things that tie into the overhead and the dental benefits. And so it's really, really important that you have those adjustments listed separately.